Our nation's top medical research agency is facing a major leadership vacuum. Right now, more than a dozen key director positions at the National Institutes of Health are unfilled. All but two of these vacancies opened after President Trump took office last year.
The 139-year-old agency remains the world's largest public funder of biomedical research for treatments and vaccines. NIH is also responsible for communicating crucial information about public health. For more, we want to bring in NBC News health reporter Aria Bendix. So, Aria, let's talk about what is driving all of this turnover and which departments are feeling it the most.
Right. So this is an unprecedented situation that the NIH is facing right now. Essentially, the Trump administration has fired directors or let their contract expire faster than it can replace them. So one of the most glaring vacancies is actually at the National Institute of Allergy and Infectious Diseases. That's a division that Dr. Fauci famously led for nearly 4 decades. Wow. His replacement there, Dr. Jeannie Marazzo, was actually fired by Secretary Kennedy in October. Still no replacement for her within that post. We are also seeing a vacancy at the Division for Neurological Disorders, which funds Alzheimer research. So these are really key, important roles just essentially sitting empty here.
But, I mean, to say the quiet part out loud, there's been a lot of partisanship that we just haven't seen before. I mean, the NIH has largely, in its history, operated outside the parameters of partisan politics. And now we just saw that, all but two of those positions were vacated after President Trump took office. So now with Robert F. Kennedy Jr. leading this and filling these appointments, what does that actually mean for research?
So staffers are really concerned that whoever's appointed to these new director positions will be more loyal to the Trump administration than they are to independent science. We've seen evidence of that, at least according to staffers, based on the selection of Kyle Walsh, who's a close personal friend of the vice president, to lead the environmental health division, even though the former director there, it was actually just re-upped for a second term. So the long-term concern is that there will be sort of this slow bleed of scientific talent, and the U.S. could become less competitive in terms of biomedical research compared to other countries like China. So there's a lot at stake here.
It can have a lot of public health impacts worldwide, not just here. Are these terminations and resignations, are they unique to NIH? Are they affecting other health agencies as well?
It's a great question. This sort of slow bleed of talent that we've seen at NIH, we've actually seen it a lot more publicly at the CDC. You may recall the former CDC director, Susan Menard, was actually fired by Secretary Kennedy just 29 days into the job. And then several senior officials at CDC resigned in protest shortly thereafter. So federal health workers worry this is part of a larger pattern across these health agencies. And the administration, for its part, says it's focused on filling these roles with the most qualified candidates, but we just don't know who those people will be yet.
Wow. Aria Bendix, excellent reporting. Thank you so much. We appreciate it.
Thank you.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.